Posted. Okay, wash your hands.
Okay,
Stay
will do.
home. Right on. 8:50. We are going to let's go to GMH, Guam Memorial Hospital. Um, Lillian Posadas, the administrator. Good morning, Lillian. Thank you so much for joining us.
Good morning, Lillian.
Good morning. Good morning, Chris. Good morning, Sabrina. Good morning, Jay. So, how are you all?
Well, we're just kind of, I think, like a lot of people, reeling from the announcement of the 3 COVID-related deaths yesterday, and the positives continue to climb. Although we're not doing as many tests, we're still seeing that testing positivity rate increase. So we're just kind of dealing with that this morning. But now that we have you on, if we could just start with the 3 COVID-related deaths, if you could just go through them and give us any information that you might have on those.
Okay. Well, if I could just preface it that yes, the numbers continue to increase, but that's going to be the reality. And so we just need to acknowledge and accept the fact that this is going to be our reality. People are going to be positive, and we shouldn't be more anxious about it. We shouldn't be fearful, and we shouldn't panic. But and just be calm and be cool about it, and help those individuals who are positive to get the medical attention quickly, and not wait till their condition or their symptoms start to really take its toll on them, that they're having a hard time breathing and they become hypoxic, or that the abdominal symptoms that they're experiencing with regards to vomiting and having any diarrheal episode, that they don't get dehydrated. So, I just want to encourage people to get medical attention once they start feeling the symptoms, so that they can recover, they can heal from the infection, much more quicker, hopefully, and without too much of a symptoms that will really make them feel weak and
Right.
and needing to be hospitalized.
And
So
Lillian,
thank you for
I'm
giving me
just,
that.
I'm guessing that you're prefacing your information with that because one of the deaths was a dead on arrival, and then another one of the deaths that we saw a couple weeks ago was a man who had been brought from home and was already.
Yeah.
I mean, so obviously
Was
people,
found unresponsive.
right?
Right.
People are waiting too long to seek the medical care, is what you're trying to say.
Well, and and maybe they're scared. Maybe they have their own reasons. They don't want to, go to the doctor. But this is where we need to kind of encourage them to get medical attention. It doesn't have to be the emergency room of GMH or GRMC. There are private clinics out there that I'm sure will, accept them and get them the help and the treatment that they need. But okay, back to the topic of the 3 deaths. I can only speak on the 2 because the third one was
Right.
up at Naval Hospital, and I have absolutely no information on that third
Okay.
death. So the 2 that that expired here, well, actually the first one was an expired individual from the home. And so when the individual was brought to the hospital, it was basically to pronounce the death. And so that was a little bit after midnight, and it was a 73-year-old female individual. So, and I don't have much of any information on that individual, other than the body was 73 years old and female, and was swabbed, and the results came out to be positive. The second one was a young individual, quite young, in the 30s, and that was really a difficult one to talk about, because it's a young individual. Not that the 73-year-old was not difficult,
Yeah.
but any death can really is it's a difficult thing and can you imagine the family? So those are the 2 deaths that we experienced yesterday.
What else can you tell us about the 36-year-old female?
The individual came in on the 31st, the evening of the 31st, about 4:30. And, there were underlying conditions, pretty serious underlying conditions. And so, the individual was already pretty critically ill when she came into the emergency room. And so the doctors had to work fast to help that individual. Unfortunately, the condition was so serious, so critical that they tried their best to save the individual. Unfortunately, they lost that battle.
Can you explain, Lillian, the classification of these deaths as COVID-related deaths?
Well, the individual who came in expired from home because of the swab result being positive. So, we can only say it's COVID related because the fact was that the test came out positive. The other individual, the young one, again, because of the test result, was COVID positive. But the underlying medical condition was really more, I think, the prevailing cause, contributing factor to then how the individual then succumbed to death. So we can only say it's COVID related because the fact of the matter is that the test results came back positive for both.
Can you tell us anything about that underlying medical condition with the 36-year-old female?
It's a kidney, it's a kidney underlying condition.
Okay. All right.
Lillian, have there been any other deaths since in the past 24 hours?
I haven't heard of any other deaths within our organization. I haven't heard another individual being brought in as a DOA. I haven't. I don't know. You heard something?
No, I
Because
just
I
figured
haven't
I'd
heard
ask.
anything.
Yeah,
Because
we just asked because
No,
it came
ma'am.
out at midnight and we didn't hear about it till, almost
Right.
24 hours later. It's
Right.
concerning.
When I don't get a call at 1 in the morning, that means I guess, or 4 in the morning. So I didn't hear anything, and I have no data or no report that there was another individual that expired.
Okay, so could we go
Okay.
into the COVID census and then, we'll ask some questions?
Sure. The
Okay.
COVID census as of this morning was 42. We do have an individual in the emergency room who is a PUI. So we're just waiting now for the final results. They did the Abbott. It's negative, but I think because again of the manifestation of symptoms, the doctors, the clinicians want to do a PCR test. Um, and of the 42 COVID individuals that we have in the house, 6 of them are ICU level of care. And of the 6, 3 of them are on ventilator support.
And then the rest?
What was that?
The rest?
Okay.
The 6 ICU level of care, are they in care 3? I can't remember.
Actually, I know it's confusing, right? Care 2 is the ICU area for COVID. There are 3 individuals in that. The census is 4. 3 of them are ICU level, and 1 of them is telemetry. And so, yes, we do have the individuals on ventilator. One of them in the ER waiting is an ICU level and is on a ventilator also. So we have total of 3 on ventilator.
And then the remaining COVID patients, they're dispersed between the different care units?
Yes, ma'am. Between Care 3, Care 4,
Care 5?
and some in Care 5 are not ICU. So
How many
yes, we have them.
How many other,
Go ahead.
so we have the 3 on the ventilator. How many others are receiving supplemental oxygen?
There's quite a bit on either BiPAP or on high flow nasal cannula. There are some who are not receiving supplemental oxygen. They're on room air. So basically, they're stable, and hopefully that they can, be released to either home or to the isolation facility. It just depends on the update examination of the clinicians to see if these individuals are indeed very stable and can be released out of the acute care facility.
Where are we with the skilled nursing unit?
Well, the good news is that the temporary chiller is working very well. It's keeping the facility very comfortably cool. And so it is ready to be occupied by the patients. And so we just got the green light today. We can begin moving some of these patients out of our acute care facility. And so we're, again, juggling with our staffing because we do have some staff who are out on isolation and quarantine. So we're adjusting the staffing to then make sure we have the coverage up at the SIF.
So, go ahead, Bree.
So it may be ready, but we just aren't sure when we're going to be
It
able
is
to
ready.
move. Right, it's ready to open up, but in
Facility is
terms
ready
of
for occupancy. It's just now the staffing
right.
that we need to make sure we cover it adequately.
Okay,
Yes.
and then speaking of the staff, we had Dr. Hoa on earlier, and he said 5 doctors that tested positive and up to 20, possibly up to 20 nurses infected with COVID. Do you have any
There's
finite
more than
numbers?
20. There's
Okay.
actually 32 employees. In this second wave, there are 32 employees, including some doctors who have now tested positive. So, that taxes our staffing situation because these individuals have to be out, they have to be isolated, and we have to give them time to heal and to recover and regain their energies to then, get back into working in the front lines. And so we just need to make sure that they recover from it, they heal.
Right. So that's 32 GMH staff, nurses, and doctors that have.
It's a combination of all employees because we also have here in the administration.
Right.
So it's a combination of clinical and non-clinical staff.
And that's just during this second wave. We're not
Correct.
talking about the first. So
No.
how many of them are
The first wave we had 12.
Right. Wow, that's pretty alarming, Lillian. How many of these are so these
Well,
32? They're active.
It is alarming, but again, it's not as alarming as in the other places in the United States. But putting it into perspective, we have a smaller population, smaller volume of patients and staffing. But yes, it is, and so we're doing everything we possibly can to keep these individuals safe and protected by providing all the PPE gear, the training that they need. But unfortunately, this virus attacks anybody and everybody. So, we just have to continue exercising all the infection control preventive measures. And, even the best hospitals in the U.S. that have it, they still have, infections that occur in their facility.
Lillian, are you able to tell
And
us?
we deal with it. What was that?
Of the 32 positive GMH staff, how many of them do you believe contracted the virus outside of the hospital setting? And how many do you think? Go ahead.
I can't say how many, but the first 5 that were COVID positive, all 5 of them contracted it outside of the hospital because these individuals. Hello?
We can hear you. Sorry.
These individuals, the first 5, they were not at all in direct contact or interaction with the COVID patients. They were working elsewhere, not with the COVID individuals. And so that definitely shows that, they contacted it outside of the hospital.
What about the remaining 27? Are those nosocomial
I haven't had a
infections?
chance to look at the data. I haven't had a chance to look at the report. But, I will do that.
We had
Many
Dr.
other things are going on.
I know.
What was
Lillian.
that?
We had Dr. Hoa Wen on the show earlier. I don't know if you caught the interview because I know you said you were in a meeting. But he's saying that the Physicians Advisory Group is really pushing GMH to have a press conference about this
Nosocomial infections?
the nosocomial infections at the Guam Memorial Hospital. And I mean, with you just kind of dropping that we have 32 COVID-19 positive staff at GMH, could you shed any light on what Dr. Wen and the Physicians Advisory Group is talking about?
Okay, sure. Nosocomial infection is hospital-acquired infection. And that means, when a patient comes into the hospital, there's always a possibility of getting some kind of an infection, whether it's staphylococcal aureus infection or some other type of infection. But, because the individual is in the hospital, therefore that infection is hospital acquired. And it's not an uncommon occurrence. It happens in even in the best hospitals where they have really robust and strict infection control guidelines. It happens, because microorganisms that cause disease are everywhere. So it's not an uncommon thing to occur. And I know that you're probably referencing this to one of the nurses who passed away, and that the commentary from outside, that this nurse caught the COVID here in the hospital. Well, the fact is that the individual was here in the hospital, was not COVID positive, and then throughout the hospitalization course, the individual who then, expired, became positive. And so, of course, people are going to say, yeah, one, the fact. Second fact is the individual caught. So, of course, they're going to say, you can come to that conclusion that the individual caught COVID in the hospital. While the facts are still being explored and being investigated, and I'm not going to deny it, but again, if it does come out, the conclusions, the findings that, yes, the individual acquired COVID in the hospital, that's one patient. One out of the thousands of patients that we admit into this hospital who are non-COVID have gone home. Many of the patients have gone home, released from the hospital without the COVID infection. So to put it into perspective, if that is the conclusion, one individual caught the COVID in the hospital, that's one. And in the U.S., like I said, 5,000 cases, 20% of, individuals who come into the hospital in the U.S., they acquire COVID. They get the COVID infection, and it's not an uncommon incident.
Right.
So let's not panic about it. Let's not go, oh my goodness, the hospital is not doing enough. Well, look at the data from the time that we started taking in COVID patients to now. One incident,
right.
one
Yeah.
person. So let's not scare the community.
Yeah, no, we're
Let's
not.
put a panic.
Of course, we're not trying to scare the community, Lillian. But I mean,
No,
yeah.
But and I'm not saying that we're scaring the community, but that's what's happening.
Right. Of course, they're scared.
People are now
People are already
more
scared.
afraid.
They're scared before they heard about the nurse and catching the COVID in the hospital. They were scared before that. They're going to be scared after it. But I think what's concerning is that we're talking about one patient, right? But then what about the 32 staff? You can't conclusively say that they didn't catch it in the hospital setting.
Okay, but then we're also going through the process.
Right.
Once we find out that they're COVID positive, they're off. They're put on isolation. The ones that are then exposed by those staff, they're out on quarantine, and our infection control nurse is monitoring and tracking them very closely to make sure that they are without symptoms or that their retest is still negative. So we are closely monitoring that.
Mm-hmm. And what about the contact they have with patients?
Those, again, we haven't had any patient that tested positive. The infection control team is making sure that if that staff exposed certain patients and even the co-workers within that area, they've been followed up, and fortunately none of them have tested positive. So it goes to show that the staff are exercising to the best of their ability the infection prevention measures.
How many people are on this infection control team?
Well, right now we have the nurse who is the infection control practitioner. There's a doctor that works with her, and then we've given her several other staff to help her out.
And so how many? I'm sorry. How many are part of the infection control team?
I don't have the numbers. We have given several staff. There is this individual who's also a nurse, admin staff. We've got a couple of others, and we're hoping that the school nurses who are going to come to help us out, some of them have expressed an interest, and that because of the anxiety, the concern of working again in the hospital setting when they haven't worked in that. And so we're offering that option for them to help us out in the infection control and in the employee health office to do the contact tracing, to do the follow-up and the investigation.
Okay, so
there's more than 5 of them. There's more than 5 in that area.
Mm-hmm. Can you because people are talking out here, and I just want to know, is it true or not that one of the reasons why the hospital lost accreditation was because of deficiencies with infection control? Was that one of the things that were cited?
Okay, go right ahead. I can't remember and I can't recall exactly why the accreditation, but I know that quite a bit of it is the physical structure, with the leakages, the leadership was mentioned, and maybe infection control, because at that time we only had the one nurse, doing the infection control, and that's not sufficient. You need more resources and more manpower. The other parts where I think the quality assessment, performance improvement program and activities, the risk management was another area. So it was quite a spread of issues
Right.
that the Joint Commission.
Do you know when the FEMA help will be arriving?
And how key is that support going to be for your staff, Lillian?
Oh, it's very key because they're going to bring us, from what I found out, what I heard, that 15 critical care nurses. And that's exactly what we need, are critical care nurses. And so, an infusion of 15 critical care nurses, oh, that's great. That's really fantastic. When they're going to start, I will find out tomorrow when I meet with the Region 9 Regional Emergency Coordinator who is here on island. And so we're scheduled to meet with them tomorrow, I believe in the afternoon. What was that?
Bryant?
Mr. Bryant? Mr. Bryant from Region 9?
No, Mr. Bryan, I think, deals primarily with the alternate care facility that we're working on. Mr. Jonathan Bartlett.
Okay,
is
from
the Region 9.
Yeah.
The Region 9 Regional Emergency Coordinator.
But you said 15 critical nurses are just what you need, but are you really going to need?
No, that's not what I said. I didn't say is what I need, what we need here in the hospital. We need more than that, but they're giving us 15, which is a tremendous help.
How many do you need?
Oh, what we requested was around 30 some critical care nurses. Because, for the emergency room, we need help there, and for ICU.
Do you know where you're going to put the 15? Are they going to stay at GMH, or do you plan on moving some over to the SNF?
I don't know yet because we're going to meet tomorrow with Mr. Bartlett. And so, but this is preliminary information that I received, 15 critical care nurses. And so if we can use all 15 in the emergency room and ICU, that will be tremendous because then at least we can open up more ICU beds.
And just really quickly for clarification, the SNF is ready to open, but you cannot open it because you just don't have the staff yet.
We're still trying to resolve our staffing issues, correct?
Okay.
But it's physically ready for occupancy. So the other teams, such as in the operations, professional support, they're making sure that the supplies are there. They've got it pretty much making sure that they've cleaned it out, the facility, and that, whatever other medical equipment we need to have there. The team is working currently to make sure that everything then is ready for them. If tonight we say we can move those patients, we'll move those patients.
Lillian, I know that you had talked earlier about, the public shouldn't be scared. But just in the last 24 hours, we've seen, several doctors, Dr. Wen, Dr. Eusebio, Dr. Cabrera, kind of ganging up on GMH and, saying things about we need to move the non-COVID patients because the risk of exposure. And these things, when these doctors say this, they snowball, right? And a lot of people are talking about it. So I wanted to give you the floor and just ask you the question, is GMH safe for the people of Guam?
Well, hey, look at the numbers. Since we started in March taking care of COVID patients, look at the numbers. Okay, we've taken care of over 100 individuals with the COVID positive. Many of them have recovered, have healed, and have gone home. Unfortunately, yes, we lost 5 in the first wave. But again, over 100 individuals we have treated here in the hospital with COVID. More than 1,000 of individuals that have come into the hospital, we treat them, their critical condition, and we managed to get them saved and off the ventilator. And these are over 1,000 non-COVID patients that we are in the hospital and they go home, they get discharged. MCH, I know that's a hot topic by a lot of the doctors out in the community and are pushing to move MCH. And, again, since we started in March, none of the NCH patients have contracted COVID. They come in, the women come in, they deliver their babies, they go home. The babies are in the nursery, they get discharged, they get well, they get discharged, they go home. Pediatric patients are, we get them admitted into the hospital, they heal and they recover and they go home. Mm-hmm. And so, again, for the people who are pushing for us to move NCH, well, they don't realize that it's not a simple thing to do. It's a complicated process. First and foremost, the facility, GRMC, they welcome to have MCH services, to provide MCH services at their facility, which is great, and they can start that on their own. But here's the situation. The challenge for them is that for us to move the NCH services over to GRMC means we have to also then deploy all our nursing staff to GRMC. We deploy them. They're still government of Guam classified employees. Mm. We have to continue their payroll, but they're going to be providing the service in another business organization. Right. Now, Business 101, we're paying the payroll. They're going to do the service over at another entity. Does that make sense?
Is that why we haven't moved the ward?
So that's the main reason.
Again, it's not a simple thing to do. We have to make sure we have been talking about this since the beginning of this year. Right. We've been discussing it, and we're just trying to make sure what really is the best for everybody, not just for a certain group, but for everybody all around. And again, I go back to the nursing staff who are Gulf Guam classified employees. Are we going to force them to then end their employment with Gulf Guam so that they can then be employees of GRMC? Are we going to force them that? I don't think we can force them that. But and the liability, if something happens, they're providing the services as a Gulf Guam agency or an agent. If something happens, are they going to be covered by the Gulf Guam claims and insurance? Those are many questions that do not have easy answers. Mm-hmm. And so, our point here is we continue to provide the services here, and we continue to provide the services for the COVID patients. And we've been successful. I like to say, I'm not bragging, because it's really the staff who make it happen. They're the ones who are working tirelessly to take care of all these patients. And so, credit to them. They're doing a great job, a fantastic job. And, for us to just uproot the whole MCH service and give the staff to GRMC, the nurses are not all that, again, excited to be uprooted and go somewhere else. But if they want to, they can then end their Gulf Guam employment here at GMH and then apply and be employees of GRMC so that they can continue their practice in their specialty as MCH. But it's not an easy and not a simple thing to do. If GRMC would like to open up the MCH services, that's great, wonderful. Because at least it gives people an option, a choice. They can go to GRMC or they can come to GMH. That would benefit the community.
If you didn't have to worry about all of that, the business side of it and the money side of it, would you agree that they should be sent over, these non-COVID patients, over to GRMC? That there should be a non-COVID, absolutely 100% not COVID, and a COVID hospital?
And thank you. That's a great question because, also I mean, why can't they take the non-COVID telemetry patients, the non-COVID medical surgical patients, the non-COVID surgical patients? That will help us tremendously, and because they have the infrastructure, they have the beds, and so therefore it's a lot easier to just move those telemetry patients if, as they have been taking some of them, non-COVID. Given the staffing situation, they do take them, but why not then start there? Non-COVID telemetry patients, non-COVID medical surgical patients, non-COVID surgical patients. That will be the easiest way to then help the hospital and for us to open up our beds. We still maintain our staff, and we can then, staff those beds for more COVID patients.
Has the ask been made?
What's that?
Has the ask been made to GRMC because they're saying, hey, move the non-COVID patients out, and now you're saying, hey, yeah, take them, take these ones though.
Well, we've been in discussions with the leadership, and we will continue. I will reach out to Dr. Mike and engage in further discussion. But
Right.
Our chief medical officer, Dr. Annie Berdaliu, and Dr. Ogren, they've been in discussions with these
Okay.
doctors and with the PAG. They're members of the PAG.
Right. So is there like a conflict or any kind of issue with Dr. Mike? We all know he's GRMC, and then leading the surgeon cell. Is GMH getting like the short end of the stick, Lillian? Are you being treated fairly as a public hospital?
It's not my authority or jurisdiction or even I don't have any data to say that it's a conflict. That's not my business. It's not my authority.
Well, because
what Dr. Mike does, he's helping out the governor, and so that's great. Now,
but
as
is
far
he
as
helping
are
out
we getting
GMH?
Are we getting the short end of the stick?
Yeah.
That's people's judgment, I suppose. But we're doing what we can in the best way that we can, given our resources, and our staff are doing. Again, I'll repeat it. They're doing really an outstanding job. And to hear comments out in the community, negative comments, criticism, and it doesn't help our staff. It discourages them. It demoralizes them. And when we lost our nurse colleague, these nurses, they say, you know what, we quit. We're ready to quit. Is that what we want to happen here? Do we want to lose these nurses? If we lose these nurses, who's going to take care of these patients? Mm-hmm. So we need to be more supportive of each other and working with each other and not against each other. Mm-hmm. The virus is our enemy, not each other. So I'm just, I just want to encourage that, we get the support, we get the positive, statements as far as, and it's not for me. This is not about me. It's for the staff here at the hospital, and not just the nurses. But, we've got the housekeeping people, we've got security, we've got the non-clinical people who, are processing the medical records, the billing, so that the hospital can get reimbursed, because we're losing revenues in the hospital because we're not doing a lot of elective surgeries. So,
so then, Lillian, again, what is the issue? Like you said, Dr. Cruz, he's on the PAG. A lot of these people, they're all on the PAG. And we all know that you guys need space. Why? And you guys have been talking about it. Why haven't they been moved already? I'm talking about the ones you're talking about, the telemetry patients. Why haven't they been moved? If you guys have been talking about it,
they have their challenges over at GRMC.
Who is stopping this?
What's that?
Who's stopping it?
Who's stopping it? You guys are already, according to Dr. Ho on the PAC, he said GMH is on fire and they need help. So
what?
He said GMH fire is on fire.
Absolutely.
Right. You guys need help, but and you said it. Yeah, take our telemetry patients, take this. We've been talking about it. At what point does the talking stop? And we just do it.
I can't answer for other people's actions. I can only answer for my action and my, I can only be accountable for myself. And, what other people say and what other people do is not my, I don't have control of that. So
yeah, I'm just wondering, Lillian, because you are at GMH, you're in the fire. When are you going to say, look, we need our non-COVID patients in the telemetry ward moved over to GRMC. Stop talking about it. Let's move them today. Let's move them 5 minutes ago. when are you going to get that mad and say,
I know,
let's
right?
go?
I need to get mad.
Yeah, you got.
Yeah,
Please
you
get
need
mad.
to get mad, Lotnya. I mean,
Please,
what
please
is
get
going
mad.
on?
Please get mad. Can you just get mad now?
Yep, I can get mad, but you know what? It's not. I have to be cool and calm about it, but get my point across.
Yeah. You
Because
just
they
got.
people will hear.
Yeah, you just got to get that one-on-one with the governor and plead your case to her because obviously there's some kind of blockage. I don't know who it's coming from, but I really just hope this isn't as simple as like public hospital versus private hospital because that's what it's looking like.
And it shouldn't be. It
Yeah.
shouldn't be that way.
Totally agree.
Yeah.
Good.
Was there anything on the morgue? Are you guys?
Yeah.
I mean,
Morgue capacity before we let you go.
Well, again, we're just the beds up at SIF. Those are 54 beds that we certainly can open. And if in our meeting tomorrow with Mr. Jonathan Bartlett, and if we get more, if we're going to get the 15 critical care nurses, that's a welcome relief for our staff. It's really going to be helpful.
Morgue.
the morgue.
Yeah, morgue capacity. Are we okay on the morgue side?
The morgue side, we're it's filling, but again, once the funeral homes take these individuals, the remains, the bodies, to then get them buried and or cremated accordingly, it opens up. But we still have that 40-foot reefer,
Right.
and it does have 17 cubicle space, and so it hasn't yet been used, but it's good to know that we have that available space for the morgue.
Lillian, thank you so much for your time. We're going to let you go grab the fire hose.
Yes, please.
Okay.
Yes, please. I got to get back to work.
Thank you, Lillian.
You take care.
Hasta, okay.
Take care.
Bye.
Be safe.
Yeah, you
Bye.
too. You too. Okay. 9:27. Well, I got to take a break, guys. Just super quick. It's the link on the Breeze 93.9 coming.